and the role that yoga can help in improving your A1C and your blood sugar. And after I explain a little bit, then we're lucky enough to have Melissa teach us the meditation and yoga at the end. So thank you. So as we start with yoga, meditation, and diabetes, so those of you with diabetes or who have loved ones with diabetes know that diabetes is not just physical. It doesn't just impact your heart and your kidneys and all those things we've talked about, your eyes, but it also has an emotional toll. It does require that you make psychological changes in the way that you think about food and life and exercise and all of these things. It is recommended that when somebody's diagnosed with diabetes, a mental health screening is done because it's very stressful. And it's not like you're diagnosed with something like bronchitis, where you take this antibiotic and it's over with. It's, oh, you have diabetes the rest of your life. What do you need to do? So that's very stressful. So there is a program called
I'm so sorry, Amy. I'm just going to take a minute because there was a little bit delay on going live. Oh. So just to go back to our panelists, so we have Melissa Stanley. She's a registered yoga teacher, and Amy Wilcoxon, our program director for United Medical ACO, and myself and Donna Gunkel. So I'm so sorry to do this, but I had to do it. So
you want me to start from the beginning with the slides?
No, they got those, but I think you are kind of cut off, but we are good now.
Okay, can you go back? I wasn't done with that slide though, please.
All right.
Thank you. All right, so there is a program called mindfulness-based stress reduction. And it's used in hospitals, it's used in retreats, it's used in medical clinics, and it's used with chronic illness typically, including diabetes. So it's used also for general health and for stress. It's an 8-week course typically. And what they teach is mindfulness meditation, sitting meditation, and gentle yoga is taught. And this has been, I think the 70s or the 80s is when mindfulness instruction, actually in the 60s, was used to touch on chronic illness. And then these programs have been developed, and there is a lot of research showing the efficacy of this mindfulness-based stress reduction. Now I'm ready for the next slide, please. Thank you. So what is meditation? So a lot of times we think meditate, we think people going, sitting cross-legged, closing their eyes, humming, and people think, well, I can't meditate. I know a couple of years ago, and I've taken yoga with Melissa, and there's talk of meditation. And when I can't meditate, my brain can't not think of something. We always have all these thoughts going around in our brain. But I learned, as we're going to talk about, there's different types of meditation. So meditation defined by itself is the intentional self-regulation of attention. So if you think about when you're doing something, we're often on autopilot. So when you're driving, you're not really, well, hopefully we're all paying attention, but you don't necessarily have to think, all right, so I have to turn the wheel this way and I have to now push my foot on the brake because it's autopilot. We're able to do that automatically hopefully not while we talk on the phone, but while we change the radio station. Think about other things at the same time, so much to the point where you might get home and be like, oh, I hope that light was green that I went through, because it's so automatic. So with meditation, we're trying to turn back to that regulation. And this ties a little bit into our October webinar, which is on YouTube, about mindful eating that we talked about. So in meditation, we're trying to develop our sense of self. What do things feel like? What do they taste like? What do they smell like? And there's different types. And I talked about that earlier, that it's not always just blanking out. So there's transcendental meditation, mindfulness meditation. So some do emphasize concentration. You may have heard or seen cartoons or experienced or done the kind of practice where you may use chanting or use a word. The first gym I ever belonged to, there was a yoga studio in the back, and we would always hear this as we were lifting weights. We would say, what's going on back there? Before we really knew what was happening. So that was transcendental meditation. And then mindfulness meditation, which is what we're going to focus on, which is what's used with diabetes, is a non-judgmental awareness of self. So we're not necessarily going to concentrate on one object. We're going to allow thoughts to flow in and out of the mind. one of the classes I did with concentration was where we had to look at something and really focus on the point. So there's a picture of a pyramid and we had to really focus on the point of the pyramid. I really struggled with this because I couldn't just think about the point of the pyramid. But with mindfulness meditation, we're allowed to have thoughts to move on. Next slide, please. Thank you. So mindfulness-based stress reduction uses both meditation and yoga to create awareness of the interaction between body and mind. There is a lot of research also with yoga and meditation for eating. And we know people that struggle with binge eating, overeating, compulsive eating, yoga helps because it forces them to be more mindful about what they're doing. So they may stop and slow down when they're eating. It allows you to observe your thoughts. So as you think something, as it goes through your mind, you're able to see it and ideally let it pass by without, oh, that's good, or that's really bad. Oh, I can't believe I ate all those cookies. That you're able just to think about the cookies without judging yourself for being good or bad. Anybody at any age can learn to meditate. So you don't have to have a certain educational background. You don't have to belong to a certain culture. Anybody can do it. And as I said multiple times, it's well documented, the health benefits. You don't have to give up certain foods. Some people think, well, if you do yoga, you have to be a vegetarian and you have to be a healthy eater. Melissa's laughing at that one. Because we know that she's not a vegetarian, but you don't. So you don't have to follow a special diet to do any of this. Can I have the next slide, please? Thank you. So diabetes does affect your body and mind, as we talked about. So people with diabetes are 20% more likely to experience anxiety in their lifetime than people without diabetes. Additionally, about 25% of people with diabetes have bouts of depression, and some of them may be long lasting. As I said earlier, mental health screening is recommended at diagnosis, but it is also recommended routinely because diabetes is very stressful. So not just physically on the body, but mentally. Because as I tell my patients when they're diagnosed, there's no vacation from diabetes. And that is stressful to think that I just can't forget about it. I always have to take care of it. It may also interfere with relationships. So if you are with a family that's a family of feeders, they want to go out and they want to have pizza every night and you feel like, well, you can't really do that. And that is going to be a burden on your family. That's stressful also. You may feel it's very expensive to buy these healthy foods. Again, a stress. And then we certainly know there's many physical complications. And we've been talking about those for really the last year. Percentage of heart attack or stroke over a lifetime is about 70% or more. Blindness is 5% or more. Amputation is 10% or more. And end-stage renal disease is 5% or more. So a lot of people are aware of these, and that causes a lot of stress, paying attention to that. So the recommendation for exercise, actually for everybody, not just people for diabetes, is 150 minutes or more of aerobic exercise per week, including strength training. Yoga, and Melissa, you can tell me if you agree, yoga is both aerobic and strength training.
It can be. It can be both.
So it really probably depends on the style of yoga that you're going to, right? Yes. So yoga has been shown and has been studied to lower blood sugar, lower blood pressure, improve cholesterol, and lower the need for diabetes medications. So you really have a win-win. We have a practice here that's helping you be more mindful, helping you focus in on what you need to do, but also having physical benefits at the same time. And what I like about yoga is that anybody can do it. So Melissa later is going to talk about chair yoga. So yoga, a lot of people think, and I was one of them, because I'm not at all flexible. Well, I can't do yoga. I mean, I can barely reach past my knees. How can I possibly do that? But yoga is for everybody. So it does increase flexibility. It does. But I still can't barely reach past my knees. It does improve strength. It may improve your balance. It may improve immune function. And it may aid in relief of chronic pain as well. And there are types of yoga that have been offered for people with fibromyalgia and people with a lot of those chronic illnesses where it hurts to move. It does also aid in the reduction of stress hormones. And then with the So stress hormones, when cortisol is high, that can in turn increase blood sugar. It can also make you want to eat and not sleep well. And then if you're eating a lot of extra, that is going to raise your blood sugar. Also, when your stress level is high, your brain automatically craves carbohydrate.
Just to kind of, because since we don't have a lot of slides and we are going to have some interactions, one of the questions, when you do 150 minutes per week for starters, so I used to do yoga and then the sessions used to get like 75 minutes. So people who would be doing it, they have to be in a classroom in many settings, probably it's the best. And so, like, what do you suggest for those who are just starters?
Well, we're going to get to, can we come back to your question?
Sure.
Because we're going to talk about this different levels, and I'm going to turn some of that over to Melissa. All right, so cortisol, so your cortisol goes up. When your stress goes up, you crave glucose, you eat more, and you're not eating carrots. When your stress level goes up and you're craving carbs, you're probably eating cookies, and blood sugar is going to go up. Yoga also aids in the reduction of your insulin will decrease and your insulin resistance will decrease. All right, next slide, please. So I promise Kemal will answer your question. I just need like 2 more slides because we're going to tie into the types of yoga, which is going to help answer your question. So current studies show 3 months of yoga along with standard diabetes care, so seeing your doctor, taking your metformin, will reduce BMI more than just standard care, reduction in BMI and anxiety after just 40 days of yoga, and improvement in weight, blood pressure, insulin, and triglyceride after 3 months of yoga compared to just seeing somebody like me, just education alone. Next slide, please. So beneficial poses. Could we actually skip ahead? I should have put this at the last. I'm sorry to be difficult. Come on. Because I'm gonna have Melissa talk about those beneficial poses because I can't explain what locust pose is. So precautions, things that you have to be careful with when you have diabetes. If you are on insulin, you know that you are at risk for hypoglycemia. So yoga is exercise. You do want to be careful. There are sometimes, if you're doing yoga at home, sometimes in the beginning of DVDs, they will tell you like you shouldn't be eating, you should be fasting. Not necessarily if you're at risk for hypoglycemia, you need to eat. So those instructions might not be for you. So inversions where your head goes below your heart? Melissa, is that the inversion? Okay.
Yes.
So where your head goes below your heart can be dangerous if you have diabetic retinopathy. So bending your head down like that may raise your ocular pressure. So before you do something like that in class, you should talk to your ophthalmologist. So that's something that you want to pay attention to. If you're not comfortable, if you're in a live class and you're worried, you should go early and talk to the instructor. I always talk a lot to my yoga instructors about what I can and cannot do. Standing balance, I know a lot of people that we see, they have trouble with their feet. They have diabetes neuropathy, their feet really hurt. Chair yoga is really good for this if you're really worried about your balance, because yoga often we're barefoot, and some people really, it's just not safe for them to be barefoot because of balance or because of their feet with their neuropathy. And with diabetes, we don't really like you walking around barefoot. So chair yoga is probably a really good option in that case. Hot yoga is something you really need to be cautious with if you have, if your blood sugar is really fluctuating wildly, like up and down spikes, and if you're on insulin, because hot yoga can affect the absorption of your insulin. So what can happen is you can absorb it much faster than you would expect it to, and then blood sugar can plummet. So if you are new to yoga, hot yoga is not a place to start. I think, is that my last slide, Kemal?
It is the last one.
Okay, so if you can go back to the last one, but before, let's answer Kemal's question now about the types of yoga. So Melissa, can I turn that over to you to talk about the types of yoga?
Yes, I'm not going to get into too much detail because there are a lot of types, but there's basically, they basically are split up into a restorative type of yoga and a hatha or ashtanga type of yoga, which is, a lot of flow and a lot of movement, whereas restorative or maybe a yin, you have to work a little harder. Restorative, if I can just get a prop. There's a lot of cushions and blocks and blankets. I love restorative yoga. It is my favorite because you don't do any work. Once you get in the pose, you just lay there or sit there or whatever, and you are aided from all of these props. So, but the practice that most people are probably interested in for what you're talking about is a hatha or I'm sorry, vinyasa. I said ashtanga, forget that. A hatha or a vinyasa style, which is a flowy type of practice, which you can do seated. You can do it, on a mat standing. You can do a mat practice. And shoes, like you were saying earlier, shoes are not good for a mat practice, though. For a gentle style, you could wear, I have a lot of people that wear socks. I teach a gentle style class and a chair. And even in chair, I teach a gentle chair and a little bit of a more vigorous chair. Just because you're in a chair does not mean you are not getting workout. And one more thing to say about the chair is that there's a couple of different ways to use it. You can never get up. If you are comfortable sitting and that's how you want to do your practice, you can stay in a chair for the entire practice. But you can also use the chair as a prop, just like you would anything else. I think I just cut my head off, but you can hold onto the chair and do a variety of poses. You can balance, you could do a warrior or anything, holding on to the back of the chair, for those poses that we would call standing poses. Again, you can do a standing pose, you can balance in a chair, you can do a warrior in a chair, without ever getting up.
Oh, good. Thank you. So if you were, to Kemal's question, like he was taking a 75-minute yoga class, which I imagine would be difficult and intimidating for a beginner. I mean, could a person leave a class? So if it was sort of pre-pandemic and they didn't, they want to go to a live class, or let's say an optimistic future at some point, when everyone's going to live classes, could they leave a class early? I mean, or would it be best to go to something that's a beginner and more of a gentle class?
Yes, to the second part. I think it'd just be better to start slower. And I teach several chair classes in a couple different places. They're all, the ones I have taught have all been 45 minutes. I've never done a chair class. As a matter of fact, I don't teach any classes right now that are 75 minutes. That's a blessing. All of my classes are 45 or 60 minutes. The only reason I would not suggest leaving a class early, I mean, obviously, if you have to, you absolutely should. But the only reason is because the end of yoga is the best part of yoga. And it's where you just get to sit and be, and it's where your whole kind of yoga practice just kind of soaks in. So really what I would recommend if somebody's feeling, and I do this in any class I teach, if you're feeling overwhelmed or you just need a minute, just take it. It's your class. It's your body. You are the person who gets to decide. If you're in a class with, like, just for me, for an example, and you've stopped doing the practice entirely, I would come up one time and I would say, are you okay? And you'd say yes or no or whatever. If you needed something, I would hope you would tell me. But and then I would leave you alone. I used to have somebody come to yoga and take it and go to sleep. That's what she did. She would come to you, and after I knew that, I would just leave her alone because she went to sleep. And it was a heated yoga class, as a matter of fact. And she would just come in, she'd do a couple poses and take a nap for about 30 solid minutes. So, and that's what she needed somehow. And she just wanted to be in a room, to do that. But you can just sit there. You can take any kind of restorative, restive pose that is good for you. In a chair, I mean, really the most restful pose is feet, bottom, back, all being supported, hands, and just sit there. And if you're in a room doing yoga and all you're doing, if all you did the whole time was breathe, you were doing yoga. That's all you have to do in yoga is breathe, and you will leave feeling better than when you walked in.
You're always so good at selling yoga.
I love it.
have to say. So can we, I'm sorry, Kemal, to bug you one. I just want the last slide before we turn it over to Melissa to do, because I want to talk a little bit about these beneficial poses. I love this. So I'm not a yoga practitioner, but I recommend the second pose, the seated spinal pose. It's even on the GasX website to do this pose. So it's something that, oh, my son would kill me if he could hear me right now. When he was a baby and he had a hard time with his stomach. It's really good. So when people struggle with gas and constipation, I will often recommend that they do the spinal twist because it really makes a big difference. And anybody really can do it.
Yeah.
So well, I guess that's the first pose, not the second pose. So so should we go through these or should we talk about them once you just start doing? Is there any one of these you want to particularly talk about?
Well, I will just say that, I do have a certificate. I'm certified in adaptive yoga, and adaptive yoga is all about figuring out how to do a pose in a different way. So particularly the locust pose. Locust pose is on your belly it's very hard to replicate exactly in a chair. So while it might be really good for digestion, that one would really involve laying on the mat. But it's, a lot of like, if you, I don't think my camera's going to catch me on the ground, but you would lay down and you would lift your legs up. So, I mean, you could replicate it by just trying to lift up one leg, which is very, very difficult. To bring, so if even you only just got the leg back and you got this heart opening and maybe a little bit of lift in your leg, and that's okay. And I do because I do a lot of chariot poses where we move over to one side or the other, and I'm always holding on because, first of all, you don't want to do this. You don't want to lean, and it's, scary. You feel like you're going to fall out of the chair. But again, so that would be like a really opening and lifting. And then I saw another one on there is child's pose. Child's pose is another one that's, the exact pose of it is very mat based, but just to drop your head down and have your elbows supported on your knees is a version of child's pose. So, it can be done even when it's not, even if you're not on the mat. And I know, like you were talking about retinopathy. And so some people don't even want to drop their head down at all. So, you take your head in your hands. It's just anything that's really, again, restive and restorative for you.
Yeah, well, thank you. I appreciate it. All right. Any questions from Melissa on what we've talked about before she starts? Come on, Donna, no?
I don't have any questions. I've done yoga pre-pandemic. I used to try to do it twice a week, but I think I need to get back into it. So
Melissa will sell it to you.
Yeah. A question I get a lot is a lot of this, and a lot of time this is from athletes, and they'll ask how often they can do yoga because, you do your legs twice a week, or when you're working out, you don't run every single day, or you don't do something every single day. And yoga is something you can do every single day. I recommend doing it every single day, even if you did yoga for 10 minutes a day, even if you had just a little, stretch protocol that you did. You could do something like what we're going to do in a few minutes. Or, there's so many resources online, and all you have to do is, go to YouTube and type in exactly what you're looking for, and you're going to come up with exactly what you want. And that's the same thing for meditation. You might want meditation for relaxation. You might want meditation for alertness. You want to kind of pick yourself up. There's meditations for that. I am, by the way, I need to say that I am not certified in anything in meditation. I am just an interested person, and I meditate every day, and I lead meditation once a week. But again, I am not certified in it. I would like to be. Maybe 2022. But there are meditations that can do all different things for you. But the base is that you lower your blood pressure, you increase your oxygen levels, you can lower your blood sugar, you can decrease your, all of these things can happen. Sorry, I just gotta.
That's not
mine? No, that's not mine. Okay. Ooh, I thought that was me. So yeah, so in all that's at the base of every meditation that you're going to do. And I don't want to repeat too much about what Amy said, but it really is so many people, me included. I used to think I'm the worst meditator in the world. And I've discovered I'm the best meditator in the world because my brain, it just goes. And all meditation is, at the root of all meditation, no matter what you're doing, is coming back, acknowledging you had the thought. Don't judge yourself. There's too much judging going on. So don't be like, oh, I shouldn't have had that thought, or oh, I can't believe I had that thought. Oh, I had a thought. Some people like to visualize their thoughts floating away in a cloud. Some people like to actually say, thank you, I'll see you after meditation, or whatever. And you do think, and it's like you would not ask your heart to stop beating. That's what your heart does. And you can't ask your brain to stop thinking. All you can do is exercise that muscle of bringing it back to whatever your focal point is. Sometimes it's the breath, sometimes it's the body, sometimes it's the sound. You can do a walking meditation where you just really notice what is out there and nature. And, you can look at a leaf for 20 minutes and really study it. That can be your meditation. So there are 1 million ways to meditate, probably more. I'm probably being conservative.
Wow. So Kemal, I don't think we need the slides anymore, if you think we're done with those. Okay. Well, good. Well, thank you. Now I feel like I have to meditate tomorrow.
5 minutes, that's it. 2 minutes. So are we ready to start with a little bit of yoga?
Okay.
Okay. So again, I could do all kinds of things. I just decided I would do a quick little flow practice because the meditation we're going to do is going to be a body scan. So our mind, it will be moving a little bit, but a flow just to kind of tap into our bodies. But the way I like to start every single practice, no matter what kind it is just really tapping in and going inside. So if you can find a solid surface for your feet, your bottom, and your back. And when I'm in a chair, I like my hands down on my lap. Some people really like the idea of their palms being up. It's a very receiving posture, but for me, it's not comfortable in a chair. So I don't do it. And is that me?
Are you okay?
Oh, does somebody else have it said battery's running low, but
That's you.
that is me. Oh, wait a second. Oh, my thing wasn't plugged in. Oh, goodness. I am so sorry. I'm so glad we hadn't started. All right. I was half plugged into the wall. It wasn't completely plugged in. Okay. So feet, bottom, back, hands, and then close your eyes. Or if you are not comfortable with your eyes closed, just relax your gaze, just a soft, half-lidded gaze. And take a really deep breath in through your nose if your nose is clear. And let that breath out of your mouth. And take one more just like that, in through your nose and out of your mouth. And then again, if you're comfortable doing so and your nose is clear, close your mouth over and take some nice deep breaths in and out through your nose. You want to feel that breath come all the way in and feel your belly expand at least a little bit. And then when you breathe out, try and expel all the air out from you. And just take 5 or 6 or 7 breaths like that. It really depends on your rate of breathing. But if it feels fast, then maybe it is, and slow it down just a tiny bit. And if you want to, you can blink your eyes open a little bit if you want to see me better, but you don't always have to see me, just kind of listen and feel. And I like to pull myself away from the back of my chair, at least just a little bit, and then sit up nice and tall. Take an inhale, reach your arms all the way up, palms touch. And exhale, hands just to your heart, just getting a nice tall stretch in. Inhale, reach the arms up, palms touch. And exhale, hands at your heart. One more time, just like that. Inhale, reach the arms up, palms touch. Exhale, bring your hands to your heart and then back down on your lap. We're going to take an inhale. I'm going to turn sideways for this one. And on an exhale, we're going to start to round the back and drop the head as much as you are comfortable. You can even possibly touch the chin to the chest. Inhale, start in the low back, low belly. Pull that forward first, then squeeze your shoulder blades, and then look ahead or maybe a little up. That all depends on how your neck feels. One more just like that. Exhale, round and dome the spine, coming into this cat stretch. Inhale, pull everything forward, starting from the belly. The shoulder blades will squeeze. You can look ahead and you can stay just like this. We're going to do a couple more, or you can add the arms. So as you start, I'll be a little sideways. Start to round your back. You can reach the arms forward and really, really reach. And then inhale, pull everything forward, but reach the arms back, squeezing those shoulder blades. One more, just like that, or with the arms down if that feels better for you. Exhaling into your cat stretch. And then inhale, pull everything forward for your cow. And then coming back into your chair. So we're going to do some folds. So I know that neuropathy is a concern. I always like to start my folds just coming and being on my legs and kind of, it's more of a flat back. This is my fold. This is my flat back. So there's just something about a little bit of intention there. After the first two, I'm going to offer that you can bring your legs wider and fold more deeply. But if that's not something that feels comfortable for you, don't do it. If you are not sure, you can try it. And then if it's like, no, then you can just come back up, bring those knees back together. It's a good stopping point. So inhale, sweep the arms up, palms touch. Exhale, hands through heart center and come into that just kind of half fold. Inhale, lifting that heart a little bit. Exhale, fold again. And then inhale, just slowly roll up. You can even use your hands to walk up your legs. When the shoulders come up, then the head comes up, then the arms reach up overhead. Let's do that one more time, just like that. Exhale, hands through heart center and fold. Inhale, flat back. Reaching that heart a little forward. Exhale, fold. And then inhale, you can roll up or you can hinge up, coming up through a flat back that uses more core muscles. Arms reach up overhead. Bring the hands into the heart and down at your on your lap for a moment. So again, we're just going to do one more, but if you would like to fold a little more deeply, you'll just bring your knees wider apart. Inhale, sweep the arms up. Exhale, bring the hands through the heart and come into a fold. Inhale, flat back. Exhale, fold. And then inhale, roll up or hinge up, whatever works best for you. Reach the arms up overhead, palms touch. Bring the hands to your heart and down at your side. I love it when dogs come to yoga. All right, so we're going to just go into some warrior poses and and then we're going to a little bit and then we'll get into our meditation. So you want to bring your right leg out to the side. I'm going to give you a couple choices. I'm actually going to give you 3 choices. So what's most important here is that this right knee stays open because it wants to cave in. So you're going to be using a lot of effort to keep that knee open. So you can stay just like this. Some people like to, and our torsos are facing the front. Some people like to get their left leg a little straighter back behind them, which you can do. But again, focusing on that knee. And like I was saying earlier, and this isn't really the only time I'm going to show this, but you could stand behind your chair, hold on to the chair, and this is the same pose standing up, but using the chair so that you felt a little more protected. And then, so whichever one you're choosing, your arms are long, you can gaze out over those front fingers, relax your shoulders. And if you've been here the whole time, we've been here long enough, but let's take 2 more breaths. Keep your belly button tucked in just a little bit. And then flip your front palm. You'll bring that arm up in the air, and the other arm, lots of different options here as well. It can dangle, it can hold on to the chair. You can bring your forearm to your knee, but here is where your knee really does want to cave in. So you want to keep it nice and open. And just hold and breathe. Sometimes when we go into any yoga pose, we go in as far as we can right away, and there's just nowhere to go. That's not necessarily a bad thing, but sometimes we're kind of ease into it because we're a little gun shy. And then maybe then in your exhales, you can get a little deeper. One more breath. And then inhale, come back to your warrior two. And then bring that right forearm to right thigh, left arm up in the air, holding and breathing. You can always release the hand down, but again, keeping, staying in that initial position, not a bad thing. Just make sure you're breathing, make sure your shoulders relax. Take one more inhale here. And then inhale, come back to your warrior two. I'm going to grab a block. So many of you may not have a block, but you probably all have a book. Don't run and get them. I'm just going to show you the option of using one. I'm going to put it on the inside of my left foot. And then I want you to, we're facing forward, but drop the arm. And we're going to fold to the inside of this left leg. So maybe your hands can be on a block or a book. Maybe you can get fingertips down to the mat or to the ground. Or maybe you can get palms. Maybe you can fold more deeply. This is one that's really for the hips. You're going to be feeling it in the hips. So don't feel it too much, especially if this is your first time. Just you can stay pretty low. Maybe have a heavier torso. Again, you don't want to hang that head if you have any issues with the pressure in your eye. So you can keep that nice and up, but have your torso be heavy. So in hip opening poses, I could stay here all day, but we don't have all day. So let's take 2 more breaths. We want to give equal treatment to the other side. And then inhale, you can lift yourself up. You can use your hands to come up, bring your knees together, and just pause for a moment before you we rush to the other side. So yeah, so if you have a block, that is great. You can go to Five Below and get a block for, guess what, $5, or maybe 2 for $5. I'm not sure. But you can also use a book. You can use a thick, sturdy cushion. Anything works as long as it helps lift you up. So now we're just going to come to the other side. I'm just going to show you the one option, but you have the other options if you chose to do them. Now we're trying to keep this left knee nice and open. Torsos are facing the front of the chair. Arms are long. Gaze out over those left fingers. If it feels okay on your neck. If it doesn't, look straight ahead. Make sure your shoulders are relaxed. And if you're not sure if your shoulders are relaxed, flip your palms up. That usually helps guide your shoulder blades down your back. And you can stay with your palms up or just turn at your wrists and have your palms be back down. One more breath here. And then flip that front palm, bring it up in the air. Other arm can dangle, it can hold on to the chair. The forearm can come to the thigh. Keep that left knee open. Breathe. Two more breaths. And then inhale, come back to your warrior two. And then left forearm to left thigh, right arm up in the air. And breathe. You can release the hand down. If you had a block, you could release that hand down to a block, but it isn't necessary. You can just keep the forearm on the thigh. There are just so many options in yoga. And sometimes when you're in a class, it can be intimidating if you see the person next to you doing insanely crazy things. But this is where you just really have to go inside and stay on your own mat. Take another breath in and out. Inhale, come into your warrior two. Relax your arms, give your shoulders a little roll, and then we're going to fold again. So find where that works. Maybe it's elbows on the thigh, heavy torso. Maybe it's hands on something, or fingertips touching, or palms folding. Whatever it is here that works for you. So just a word about a mat. Depending on the surface you're on, mats are absolutely not necessary. They're not even necessary in mat yoga. You don't need a mat. They're just another prop. But if your chair's on a slippery surface, either move the chair or put a mat underneath of it, a yoga mat. It just keeps you safe. You know, when your chair is sliding out from under you. And then work your way up, bring your knees together. And I'm so glad that this is so Amy highlighted this pose and talked about it, because it is my favorite pose. It's how I end every single class I do these days, whether it's in a chair and a mat. Turn so that the back of the chair is on your right-hand side, and start to twist your body and holding on to the back of the chair, coming into a twist. So you can use both hands and really, pull yourself deeply into this twist. But sometimes we're super strong and we have a lot of upper body strength, and you can really yank at yourself. You're not trying to twist your back. You're not trying to hurt yourself. So it might feel better for you to only hold on to the chair with one hand, possibly even your weaker hand. And as you exhale, we just twist a little more if you can. Take one more breath here. And then inhale, you're going to come centered, and it's going to keep twisting all the way. So the chair's on your other side, on your left hand side this time. And bring yourself into a twist. As you exhale, you can try to get a little deeper into this twist, but like I said earlier, sometimes you really crank it out right away and there's nowhere to go. That's okay too. Two more breaths. And then work your way back to center. So we're going to get ready for the meditation portion. Does anybody have any questions about the yoga? There's so much to do. Again, like I said, we could be here for 45 minutes or longer.
I don't thank you. I don't have any questions. But thank you.
Okay. Okay, so for your meditation, and if there's anybody out there who wants to go lay down, go ahead. But if you're in your chair, again, you just really want to feel very supported. One thing we're not doing is Shavasana, which is the best yoga pose. And the only reason we're not doing it is because we're going into this meditation. Shavasana is just a rest. It's a quiet rest. And so we're going to take our Shavasana into our meditation. So plant your bottom, your back, your feet, your bottom, and your back, and your hands. Again, closing the eyes if you're comfortable. Take a really deep breath in and let it out. And we're going to do a body scan. So we're going to start with the right foot. And just notice any sensations you're having. And it's okay to move in meditation. If I say a body part and you have a sensation of wanting to move that body part, please go ahead and do that. If you have no sensation in the body part I'm naming, that's okay too. It's just something to notice. So again, it's just right toes. Notice your right toes. And then your foot, your whole foot, the top, the bottom, the ball, the heel. Up into your right ankle, all the way around. Notice your shin and your calf. Notice your knee. Maybe you notice something and you feel like you're holding a little bit of tension in there. See if you can relax it, but also maybe just notice it. And up to your thigh, the front and the back, the inner and the outer, the whole thigh area. And then up to your right hip and your right glute and the front, your pelvic area on the right side. Go back down to your left toes. Just notice your left toes. And your left foot, the top and the bottom. Your ankle. Your shin. And your calf. Take notice of the left knee. And up into the thigh, front, back, inner, outer, the whole thigh. And then up into your left hip and glute and the left front of your pelvic area. And then take notice of your entire pelvic area, front and back. If there's a spot you want to linger on and catch up later, you can always do that as well. Take notice of your low belly. Try to relax it. And your upper belly. And your chest. See if there's any sensation right now of your beating heart. There might be, there might not be. It's there anyway. And follow both sides of the body all the way down. And take notice of your lower back and the middle of your back. Your shoulder blades and your upper back. Come down to the fingers on your right hand. Again, if you feel like you need to give them a little wiggle, go ahead. And then notice your palm, the back of your hand. Your wrist, your forearm, your elbow, your upper arm, all the way around. And then your right shoulder head, just take notice of it, maybe relaxing it a little. Notice if there's any tension in there. And then come to the fingers on your left hand. The palm of your hand. The back of your hand. Your wrist. Forearm. Elbow. Your upper arm. And the left shoulder head. Maybe a little movement, maybe a little relaxation, or just a noticing. Notice both shoulders again, and then follow your shoulders till you meet your neck, the back of your neck and your throat. Come up to your jaw and your chin. And your mouth, all the parts, your lips, your teeth, your tongue, your gums, the soft palate, every part of your mouth. Notice if you're holding any tension in your jaw. Notice your cheeks. And then up into your eyes and all the parts of your eyes, your eyeballs, your eyelids, muscles that are holding your eyelids closed, your eyebrows. And notice both ears. And your temples. And your forehead. And finally, bring all of your attention to the top of your head. Take another moment, few moments. If there's a body part you want to revisit, something where maybe there is a little tenderness, or a place where there's usually tenderness and it feels good today, notice that as well. Start to deepen your breathing. Make some small movements, wiggle your fingers and toes, turn your wrists and your ankles. Bring your shoulders up into your ears and roll them down your back. And then take an inhale, sweep your arms out to the side and all the way up, let your palms touch. And bring your hands into your heart. Let your thumbs come to the place in between your eyebrows. And as we end our yoga and our meditation practice, we bow our heads and say namaste. Thank you all so much. Any questions?
Thank you. I think I could take a nap now.
Yeah.
No, that helps relieve all that stress of the day.
Yes.
Yeah.
It's one of the reasons I wanted to do that is because it's so easy to do yourself. And you can go as quickly or as slowly as you'd like. It took about a little less than 15 minutes. I meant for it to take 10, sorry. But you can do a quick 5-minute. You can only focus on the parts that you know are kind of achy and need relaxation. Though sometimes you don't notice till you really focus on the body part. And also, we often focus on the parts that hurt. And it's nice to notice things that don't hurt because we don't pay attention to that so much.
Yeah, thank you so much.
You're welcome.
This is great, Melissa. Thank you so much.
You are welcome.
Donna, any questions?
No, I think I encourage everybody to watch this. This is a practice that you could do regularly. As Melissa said, it's short. And there's a lot of resources online for different short things too, if you're not ready to go to classes. So keep trying. And if this is something, if you try something and it doesn't appeal to you, try something else, because every yoga instructor is different. And you might say, well, I don't like the way that one talks. We'll try another one because they're all different.
And I mean, sometimes you just don't like somebody's energy, you don't like somebody's voice, and that's okay. It's okay to not. I had a whole place not like me at all. You know what? It happens. And they didn't like my energy. And you know what? Other people really do like me. So I only pouted for a day. But I've had teachers where I'm like, oh, maybe not so much with her or him, and yeah, so keep trying, keep looking. And there's so many online resources.
And I think
Or your local Y.
Yes, or to your local Y.
You
Which
said, one of the things, and I know this too, some of the ones that I've done online, sometimes you have to find one that goes with your pace. Some
Yeah.
of them, I felt like they moved so fast that I couldn't get into the pose before she had moved on to something else. And to me, that wasn't relaxing.
Right.
So I just want to throw that out there too. If it is meant to be relaxing and to help take away the stress and, all of that helps us in many different ways, emotionally, physically, but don't be afraid to try others because some are slower. And if that's what you need, or less poses and more stretching. Like you said, there's a lot of different options and you just have to find what helps you best to relax.
and there's
You can put all of those words in your search.
yes, because there's yoga there's yoga specifically for people in larger bodies. Sometimes people in larger bodies feel, as Melissa's bending down and there's not a lot of, she doesn't have a lot of space, like if her belly's able to, touch her leg. And some people are like, well, I got a lot in between there. I'm not going to have this. There is yoga specifically for people with larger bodies. And you think, well, I can't get into this. I have this, body in between. There's yoga out there for you too. So, and just like Melissa said, Google, put it in your search what you want. There's body positive yoga. There's chair yoga. There's adaptive yoga. There's all kinds of yoga.
Yes, absolutely.
So thank you.
Thank you, everyone. Since this is our last event for 2021, until we see you next time, well, Merry Christmas. Everybody is. Go ahead, just get it out. Merry Christmas and Happy New Year, and then we'll see you next year on this program. And Buddy's coughing too. So, all right, we'll see you soon. Bye-bye.
All right, good night.